Are you a new mom who is breastfeeding and taking medication? Are you worried about the safety of taking medicine while nursing? Don't worry, in this video, we'll discuss how you can safely take medication while breastfeeding so you can continue to provide the best nutrition for your baby. Overview of breastfeeding and medication. 1. Potential risks of taking medication while breastfeeding. Taking medication while breastfeeding can carry certain risks for both the mother and her baby. The potential risks depend on the type of medication, the amount of medication taken, and how the medication is metabolized by the body. Some medications can pass through the mother's milk and be ingested by the baby, while other medications can pass through the mother's milk but not be ingested by the baby. It is important to discuss any medication you are taking with your healthcare provider to ensure that your baby is not at risk. 2. Ways to minimize risks of taking medication while breastfeeding. There are several ways to minimize the risks of taking medication while breastfeeding. The first is to discuss any medication you are taking with your healthcare provider to ensure that your baby is not at risk. Secondly, you should try to take the medication at times when your baby is not nursing, such as at night when your baby is asleep. If your medication needs to be taken during a nursing session, you can also try to feed your baby on the other side first and wait a while before nursing on the side where the medication was taken. Lastly, you can pump and discard the milk from that feeding to ensure that the medication does not enter your baby's system. Types of medication. 1. Over-the-counter medications. Over-the-counter medications are generally considered to be safe to take while breastfeeding, but it is always best to consult with your healthcare provider before taking any medication while breastfeeding. Over-the-counter medications that are known to be safe to take while breastfeeding include acetaminophen, ibuprofen, and antihistamines. However, some over-the-counter medications, such as decongestants, may not be safe for breastfeeding mothers to take. 2. Prescription medications. Prescription medications can also be taken while breastfeeding, but it is important to consult with your healthcare provider before taking any medication. Some prescription medications, such as antibiotics, can be taken while breastfeeding without any risk to the baby, while other medications, such as certain antidepressants, may not be safe for the baby and should be taken with caution. It is also important to note that some medications, such as anticoagulants, can pass through the mother's milk but not be ingested by the baby. Determining safety of medication. 1. Check with doctor or pharmacist. It is always best to check with your doctor or pharmacist before taking any medication while breastfeeding. Your doctor or pharmacist will be able to provide you with information about the safety of the medication and any potential risks that may be associated with taking the medication while breastfeeding. They can also provide you with information about how to minimize any risks, such as taking the medication at times when your baby is not nursing or pumping, and discarding the milk from that feeding. 2. Research online. In addition to checking with your doctor or pharmacist, you can also research the medication online to determine the safety of taking it while breastfeeding. There are several websites that provide information about the safety of medications while breastfeeding, such as the National Institutes of Health's LACMID, the American College of Obstetricians and Gynecologists Breastfeeding and Medication Use, and the American Academy of Pediatrics Drugs and Lactation Database. These websites provide information about the safety of medications while breastfeeding and can help you make an informed decision about whether or not to take a medication while breastfeeding. Alternatives to taking medication. 1. Natural remedies. Natural remedies, such as herbal teas, essential oils, and dietary changes, can be an effective alternative to taking medication while breastfeeding. Herbal teas can provide relief from common ailments such as headaches, nausea, and indigestion. Essential oils can also be used to provide relief from pain and other symptoms, and dietary changes can help to address underlying conditions that may be causing symptoms. 2. Lifestyle changes. Lifestyle changes can also be an effective alternative to taking medication while breastfeeding. Making changes to your diet, exercise, and sleep habits can help to address underlying conditions that may be causing symptoms. Additionally, reducing stress can help to reduce symptoms of anxiety and depression. Taking medication while breastfeeding can be a tricky situation, but with the right information and resources, it can be done safely. We hope this video has provided you with the information you need to make an informed decision about taking medication while breastfeeding. If you have any more questions or would like to share your experiences, please leave a comment below. Thank you for watching.